plan that they're working on um, for immigrants that are here in the United States. And the ones that are using the government services right now are going to have a harder time to gain permanent residency and get a green card. They think there are 1 million of these people in New York alone that think they're going to get green cards, but they're not. The whole thing it comes down to is, um, are these immigrants using our benefits that we have, like food and doctors and all kind of government resources? Because if they're using them now, then we don't want to keep supporting them the rest of their lives and give them a green card. We don't want to do it because we have too many people here that we have to give money to for retirement, food, medical, medicine, and we don't mind taking in new immigrants if they qualify, but we're not going to take any basically if we have to support them by giving them food, medical, housing, and things like that. And supposedly in New York alone, they think there are 1 million of these people. But they're considering, they call them a public charge, because if they're taking things from us when they get here, even though they might have a small job, especially medical, hospital, we're not going to give them a green card and keep them here permanently and let them get all the benefits that our other citizens get, because it's not fair. So that's what they're working on in New York right now, and they figure what all involves before the people become a public charge. That means somebody you just have to support from day one. And I noticed in the picture there that I put on, she wouldn't give her first name, but she came from Honduras in 1994, and right now she gets Medicaid for her diabetes. She works, tries to work, and her daughter is a policewoman in New York City. But it's a big problem, and we don't know how we can fight it other than we can't keep giving out green cards to people just because they live in the United States. Because if they're already taking all of our services free, food, housing, health, then what would be our advantage to give them a green card? Now, if we could, and children actually a little different, because children are small and they have to eat and they have to have a place to live and things like that. But the adults that brought them here, they're the ones I think that we're looking at real closely. And if they're using our services, for food, education, doctor referrals, and things like that, we don't want to give them a green card. Now, Cuomo doesn't like it in New York, Governor Cuomo, and he says he would sue if the government penalizes people accepting basic safety net provisions. So, and this law has not changed yet, but they're talking about it, and they're going to make a new law, and this is going to cover people that are considered a public charge. And if they're considered a public charge, they are not getting a green card, so they can stay here permanently. Thank you.